The date is set, and thousands of nurses are pledging to walk out of area hospitals.
The strike will start Sunday, June 19th at 7 a.m. The nurses work for Allina Health and plan to strike at several hospitals, including Abbott Northwestern in Minneapolis and United in St. Paul. Allina is hoping to phase out the insurance nurses get through the union and get nurses on the plan that other employees use. Allina says that would save the company $10 million a year. Nurses say that they want to keep their low deductible insurance. And Susan Elizabeth Littlefield joins us right now to sort some of this out for us. Susan,
yes, it's a little bit complicated. We're going to try to break it down here. But this is all about nurses who have union insurance. They have low deductibles no matter what right now. Nurses don't have to pay much even for ER care or even those expensive prescriptions they get. Allina says that that's costing them a lot of money, millions a year, in fact. They say it's fair for nurses to go to the other coverage that the other employees have. They say it would streamline things. Word travels fast. After an afternoon at the pool, a Minneapolis mom shares her bafflement at the impending nurse strike.
On many levels, it's confusing.
Molly Cooney, who is pregnant, says her last pregnancy and a health condition made her irregular at Abbott Northwestern.
So I would have to go and get IV fluids and medication, and they're just like so compassionate and kind and smart. You know, they just seem so capable.
So she's been following the strike situation closely.
They're humans who also need what I had, which was good insurance that could get me to the hospital of my choice.
One of the nurses fighting to keep her insurance is Angie, who was a patient not long ago. Both of her kids spent their early days in the costly neonatal unit.
With my 2 difficult deliveries in the past, that was affordable to me, and now Allina's asking me to pay now $12,000. I wouldn't have another kid if I had come home and have a $12,000 bill.
Allina Health says that number is skewed. They say the plans they're proposing have several deductible options that are affordable, saying, "We are very disappointed and disheartened that the union is striking." They say that their plan will be the same one that they already offer to 30,000 employees. The strike involves more than 4,000 nurses who plan to walk out of several Allina hospitals for a week. Some people might be wondering, why strike? That could put patients in jeopardy.
Yeah, you know, the nurses are upset that we have to come to this point, but Allina Health is not willing to sit down and negotiate with us.
And that's the plan, unless both sides can agree on a new one. Now, nurses also say they want more workplace protection after several of them have been injured by patients. Allina says they want an agreement. They want to work this out. Nurses say they want one too, but right now it seems like no one is budging. Allina does say, though, the big question here, if the strike happens, they say they are ready to protect patients. They've got backup staffing on hand, and that patients will not be in jeopardy here.
all right. We'll have to wait and see, right?
We'll see if it changes.
Yeah. Thanks, Susan Elizabeth.